So you use the maxillary forceps similar to the mandible. So this is a molar forceps. So molar forceps, this beak is having a triangular beak which is in the comes to the buccal bifurcation area. So as I said, you have to interchange the forces. One is the buccal force, other one is the lingual or palatal force, and slight rotation, and finally is the traction. Here in maxilla, if you see that this is the palate. Palate is a dense cortical bone and buccal bone is a thin bone. So buccal bone will give way easily, but palatal bone will not give way easily. So in maxilla, try to give a less palatal force. Don't give more of a palatal force, then you tend to fracture the root, fracture the crown. So this variation in anatomy. So maxilla, palatal bone is much thicker, and you try to avoid giving more of a palatal force and give more of a buccal force, and final traction should be in the buccal direction and not in the palatal direction. So always remember, when you are doing an extraction, try to give maximum time for luxation of the tooth. Luxate the tooth well, then you give the tractional force. So spend time so that bone will expand. There are some physiological changes will happen which will make the procedure easier to remove the tooth. So you give a buccal force in the maxilla. Similarly, in the anterior, you give a labial and palatal force and try to remove in the labial direction with slight rotation. And the last molar, that is the third molar, maxillary third molar. The anatomy always mandible and maxillary third molar. Anatomy is always varying anatomy. So in maxilla, what will happen is that there is a presence of tuberosity and approximation to the maxillary sinus. So it makes this tooth little bit tricky, and the morphology of the root structure. Sometimes it may be a conical root, sometimes a bifurcator, or a distally there will be apical turn, there will be curvature. So you have to spend time on luxating the tooth, and final traction should be in the distobuccal direction. Distobuccal direction. So always try to luxate well and remove the tooth.